one last question, which, I would like to ask. When or which year do you think yogic practices or these preventive medicine tools which we have, and after so much of research, is going to become the part of mainstream healthcare system?
Well, that's the great question. And the answer is, well, we don't know, but it may take decades. And the critical feature that's necessary for this implementation to take place is research. Because our societal institutions, the schools, the healthcare system, and the workplace, in order to bring something that's going to be implemented into those systems, we have to prove that what we're offering works. And the only way to prove it is through research. So, for example, a principal of a school, a yoga teacher will come and say, I'd like to teach yoga to your students. And the teacher will say, well, why? Why do you want to teach yoga to my students? What's it going to do? You're going to take time away from my students. They're not going to be able to study as long, because now when they spend an hour doing yoga, they instead could be doing their maths. Why should I do this? And you have to then provide the answer. And the answer has to be in research. You have to show that there's a research study that when yoga was practiced by children, their depression was reduced, their anxiety was reduced, their stress was reduced, their academic performance was increased, their cognitive performance was increased, their happiness was improved. You have to show the research that justifies why it's important to implement yoga into that venue. And so that's true for the schools. It's also true for medicine. You have to demonstrate that yoga is safe for patients and that it's also going to be effective. Because otherwise the doctor's going to say, well, I could have them do something else instead of yoga. You have to demonstrate a proof of efficacy. And the only kind of proof of efficacy that we have in modern society is research. So the problem is research takes time. And just to give you one example of research ultimately winning is smoking of cigarettes. Okay. In the 1950s, there were advertisements on television where we had doctors saying, oh, you should smoke this brand of cigarettes. I find it's very relaxing. And in the beginning, the research on showing that smoking is associated with the incidence of cancer was very preliminary. And the tobacco companies were saying, oh, that's garbage research. That's nonsense research. That's just, that's flawed research. Well, how long has it taken? It's taken 4 or 5 decades of research to now finally demonstrate that unequivocally smoking is a major risk factor for cancer. That's decades and decades and decades. And now we have no commercials on television for smoking. Smoking is banned in university campuses. There's warning labels on cigarette packages stating the risk factor for cancer. That's all due to the research that was done. And yet we still have not eradicated smoking entirely. It is decreasing, and that is a result of these policy changes that have come in response to the research. So, how long is it going to take for us to now implement yoga into every school system? Well, it depends. But it may take decades, but it's dependent upon the research.